Everyone, welcome to Research MD. This is Dr. Pramil, as Chief Medical Officer in the United States, also an Associate Professor of Medicine. We're going to continue our critique of journal analysis of the scientific papers. Today we're going to look at a paper published, a phase 3 randomized controlled trial of Resmetirom in NASH and liver fibrosis. Okay, let's recognize again, the article was published in the New England Journal of Medicine. As you know, if it is published in NEJM or New England Journal of Medicine, is very, very significant. Okay, so when you talk about NASH, I think it's very, very important to know this is the fatty liver disease. Okay, it has gone up tremendously in the United States. Maybe what we eat and metabolic syndrome, all of this contribute to lack of exercise. And all of those, some people end up in liver transplantation, liver failure, okay? So currently there are no drugs available to treat, so we're going to look at this drug, Resmetirom, and does it have any benefit in NASH or fatty liver disease? Let's recognize the primary author, S.A. Harrison, senior author, V. Radziu, okay? So, clinical question. What's the clinical question? This article trying to answer, can Resmetirom effectively treat non-alcoholic steatohepatitis or in liver fibrosis, actually, in the fatty liver disease lead to liver fibrosis? Okay, that's the clinical question. Now let's look at Resmetirom. It's a brand new drug, liver-directed thyroid hormone receptor beta selective agonist. That's the way it works. What happens is when you have this thyroid hormone receptor beta is impaired, that leads to reduction in mitochondria, beta oxidation, fatty acid is reduced, it increases in the liver fibrosis. That's why they come up with this medicine. Now, study design is a phase 3 randomized double-blind placebo-controlled trial, population adults with the biopsy confirmed NASH and the fibrosis stage F1B to F3, and the duration they followed these patients for like 52 weeks. Now, the population, they have 966 patients. They have two doses of this drug. Resmetirom 80 mg was 322 patients, and Resmetirom 100 mg, again, 323 patients. Placebo had 321 patients. They looked at the key baseline characteristics like age, BMI, diabetes, fibrosis, staging, and all of that, okay? And now, primary endpoint is the NASH resolution with the no worsening of the fibrosis. So, is there a decrease in fibrosis? That's the main question they were asking based on the score. And secondary endpoint, they looked at the LDL cholesterol reduction at 24 weeks. Again, what are the results? Let's look at the study results. At week 52, NASH resolution or no worsening of fibrosis, Resmetirom 80 mg, 25.9%, Resmetirom 100 mg, 29.9%. When you look at the placebo, only 9.7 has improvement. So you look at the p-value is very, very significant, less than 0.001, okay? And then fibrosis improvement, no worsening of the NAFLD score. Resmetirom was 24.2, that is the 80 milligram. Resmetirom 100 mg was 25.9, and the placebo is only 14.2. There's a big difference. Now, p-value is also very significant. Now, let's look at the number needed to treat for, as we know, the formula 1 divided by absolute risk reduction, 25.9 and 29, that is almost like 4%. 1 divided by 4%, that is 100 divided by 4. So you have to treat one in 25 patients to see benefits, okay? It's pretty significant. There's also cholesterol reduction. You got 80 milligram, 13.6%, 100 milligrams, 16.3%, placebo 0.1%, so significant reduction in LDL cholesterol. Safety profile is not that very good. Serious adverse events were not that many, but at least some of them, 90% of the people have some kind of side effects like diarrhea, nausea, and all of that, okay? Now, Let's look at the strength of the study. When you look at the strength of the study, it's a large randomized controlled trial, 15 countries, relevant population. They did have taken the patient with high risk and advanced fibrosis. Comprehensive outcome, they looked at the NASH resolution and the fibrosis improvement. They used the invasive and the non-invasive. That is the most important point on this. They did liver biopsy and they did fibroscan and MRI. A lot of people would have just gone with the fibroscan, but they did a very good, like a strong study in doing that. Now, limitations, a lot of limitations on this. Again, it was done in 15 countries. There's a lot of heterogeneity. They could have done a heterogeneity test. The population, the studies have shown more people with Asians and Hispanics are the highest number of people with the fatty liver. They did like 20% of the Hispanic, no black. They should have increased like almost like 50 to 60% Hispanic and Asian in this study. Okay, thyroid monitoring is a thyroid receptor agonist. Why don't they check TSH? I don't know. Because some of these people having diarrhea and all of that, if the thyroid has gone up, we can have diarrhea, right? Short follow-ups, only 52 weeks, that's almost like 4 to 5 years, that's not enough. You need like more years. But I think more follow-up is coming up. I should have excluded people who have taken vitamin E, because only people have taken vitamin E, they have like resolution studies have shown that. Should have excluded people with amiodarone, methotrexate, and tamoxifen, because that can cause like fibrosis, diarrhea, nausea, vomiting. Diarrhea, nausea. That's like a lot of people have it. Did it contribute to the weight loss? And then that decreased to fibrosis. When you look at the chicken or egg phenomena, what happened? Is it the drug itself, or it caused a lot of nausea, a lot of diarrhea, and a lot of weight loss that decreased, caused fibrosis? I don't know. That should be looked at it. More than 90% of them, some kind of side effect, not serious. Okay? So, again, when we look at all these things, when it was published on February 7, I think in February 7th, 2024, okay? Now, if you look at the stock price, it jumped within a month, almost like really high. You can make a decent profit if you would have listened to this article on day one, buy some stock. So next time, just kind of look at it. If it is a good study, it's a brand new drug, and you may want to buy some stocks. I did not buy, but it's up to you. So in conclusion, resmetirom 80 milligram and 100 milligram, superior efficacy in NASH resolution, NASH means fatty liver and the fibrosis improvement. LDL cholesterol improved, safety tolerable. The serious side effects were less. Future consideration, you may want to consider for a long term. I think study results are coming up like more. So the takeaway point, new drug resmetirom has benefits in NASH or fatty liver with the reversal of fibrosis, which is very important. Not many drugs are out there. With a lot of people, if you want to protect your liver and if you have fatty liver, you need to consider this drug. We also need to think about, the new drug, GLP drug, Ozempic and all that. Does have any benefit also? But again, thank you for watching. We'll be back with another presentation. Please subscribe to our channel so we can make a more critique analysis of the journals like this. Thank you. God bless.